For tuning in today to educate yourself about vaccines for fall and winter. I'm Dr. Chana Davis. I'm a contributing writer at Those Nerdy Girls, and I'll be your host today. I'm joined by Dr. Ashley Ritter, our former CEO. Ashley is a geriatric nurse practitioner and completed a PhD in postdoctoral training in health policy research. She is the director of research at New Cortland, a Philadelphia nonprofit that increases access to housing, health, and social services. Thanks for being here, Ashley.
Thanks for having me, Chana. Hello, everybody. Happy Friday.
TGIF, we were just talking about that before the show. So as a reminder, before we start answering your questions, I want to let you know that these are questions that we got through our question box on our website. So if you have questions, please submit those to our website at thosenerdygirls.org. So we have a lot to cover. We're going to be talking about COVID, flu, and RSV. So we'll just tear through as much as we can in under 30 minutes today. So why don't we start with RSV, because that's one that a lot of people may be not as familiar with since COVID's been in the news so much recently. So Ashley, can I start with you on RSV? So who needs an RSV vaccine and why?
I think that's a great question. RSV is a newer vaccine this season, and I'm pretty excited about it. On the nerd scale, I would say this is like a 9 out of 10. Big news, big health implications, and most older people should be getting this vaccine. So there's two things that I want to point out. The first is that RSV kills many older adults and contributes to significant health burden. The second is that cute, sweet, adorable, germy children spread RSV to their grandparents, older loved ones, and also small babies. And so it's really important that we think of this from a societal scale, and these vaccines for older adults are really useful. So about 80,000 children under the age of 5 are hospitalized with RSV each year. And RSV accounts for about 2 million outpatient hospital visits. So this is really a virus that causes a lot of healthcare utilization, and more importantly, can be really dangerous to young babies, specifically premature infants and children with chronic medical conditions. We don't often think about RSV as a problem among older adults, but it very much is. Between 60,000 and 160,000 older adults are hospitalized each year with RSV, and somewhere between 6,000 and 10,000 older adults die from RSV each year. So this really is a significant virus that causes a lot of sickness and morbidity and not feeling well. But more importantly, it can kill people. And so now, in a world where there's a million things that we can't control for, we have a safe, effective option to protect older people from RSV. Like, so exciting.
Yeah.
So I'm taking this as a celebration. You?
Absolutely. Yeah, I'll definitely be encouraging my family members to do that. Those that fit the eligibility criteria.
Excellent.
And sorry, I just realized I should have mentioned a couple of specific questions from our readers that informed what we're talking about today. So on the RSV, we had a question from Eileen in Madison who said, "What are your thoughts on the RSV vaccine for 78-year-olds?" So I think you've covered that.
Big thumbs up.
And then another one, Cindy from Kansas City. She asked, "I asked my doctor whether or not to get the RSV shot. My doctor replied that she had not had enough time to study it yet and could not give me an answer. I am in my 60s. I was diagnosed at Mayo Clinic years ago with chronic fatigue syndrome, and I have trouble with respiratory viruses."
Yes, and the recommendation that came out was not as forceful as I think it's a good idea for everybody over the age of 65 to get a vaccine. But I'm saying that yes, this vaccine can prevent disease as well as complex complications from RSV. And so most older adults should be getting this vaccine.
And there was another question that came up in sort of offline conversations about this vaccine, some concerns about it being mRNA based.
Oh, that's a good point, Chana. And I do want to clarify that the RSV vaccine is not an mRNA vaccine. Both the RSV vaccines approved for adults over 60 and older are recombinant protein vaccines that cause the system to produce RSV antibodies. They are not mRNA vaccines. So that's a great question.
Yeah.
Are you up for a question?
Absolutely. But let me just first drop in a couple of links for people who want to learn more, because we have some content on this on the Nerdy Girls website.
Yes, we do.
We also have a good link here from the CDC. So we're just giving you resources to learn more. We'll drop that into the comments, which won't show up on every channel, but on Facebook and YouTube, I believe you can see those. So you can always head to our website and in Google search things as well.
Yes, definitely.
So
Definitely check it out and take a look at that reading. And as much as this information is framed for the public, it's also for healthcare providers to take a look at the evidence. We've summarized it in a way that you can help to make recommendations to your patients coming into the office. My patients, I am encouraging to get the vaccine.
Okay, I'm ready.
Is there an optimal time to get the RSV vaccine?
All right. As a matter of fact, yes, timing does matter, particularly in pregnancy. People who are 32 through 36 weeks pregnant during September through January should get 1 dose of maternal RSV vaccine to protect their babies. RSV season can vary around the country, though. So if you live in certain places, including Alaska, Florida, I'm surprised to see that on the list, or outside the continental US, talk to your healthcare provider about when RSV season peaks where you live. And I have a link that talks specifically about RSV vaccines in pregnancy that I can share for
Thanks
learning
for doing
more.
that.
Yeah. And then for older adults, essentially you want to time your RSV shot so that you're protected during the peak of the season. And again, what the peak is depends where you live. But in most of the US, RSV season starts in the fall and peaks in the winter. But again, it does vary from place to place. So if you're outside of the continental US, you want to look at your local recommendations, or if you're outside of the US, period. And yeah, something to add to that?
Well, I just want to add, it's been a difficult fall. Not difficult. It's been there's a lot of vaccines that are recommended this fall, specifically for older people. And so I think good conversations are around which one should I get first? And that might vary depending on the last time you had COVID, when you can get the flu shot, and do you do that in your primary care office or do you do that elsewhere? But RSV is being given alone at this point and not with other vaccines. So you might want to get your RSV shot alone, get your COVID and your flu shot together. But it's probably going to take at least 2 appointments to get all of these on board this fall. So now is the time to start.
Yeah. Well, those practical recommendations are always appreciated. So thank you for that. So why don't we move on to talk about flu? Ashley, can you speak to, why are flu vaccines important and for whom?
Yes, I have been a geriatric nurse practitioner for about 15 years. And the flu shot is so valuable. Again, it's one of those tools that is extremely helpful. And I will also say that people who get the flu, specifically in older age, are very sick. And so I want people to get their flu shot. I'm required to get a flu shot. Many healthcare providers are required to get flu shots because our patients are at such high risk. And so it's something that I do every year. And I hope that more of the population can move to, that when October hits, you get your flu shot. I had the flu in 2019 and again in 2015 while I was pregnant, and it was awful. I remember how horrible I felt. And as a healthy, active person, if I got knocked out pretty hard. And I have seen, patients of mine get hospitalized because of the effects of the flu. So flu vaccines are recommended annually for everyone over 6 months of age and older. Children that are getting their first flu vaccine are going to need 2 doses. So it's better to start earlier in the season to achieve peak protection by flu season. Flu season, generally, you can get your flu shot somewhere between September and, through to the end of flu season, which happens somewhere between February and March is where we start to see it taper off. I like to recommend that people get their flu shot in October. October is not too early where flu is not quite circulating, and not too late where you're going to not have protection before the season really gets up and running. So October is a really great month to think about your flu shot.
But if you haven't done it yet, it's not too late, right?
Now is the perfect time. to get your flu shot. So, and then people over age 65 are going to be getting a high dose flu shot. What that means is it still has the same number of antigens, or it still has the same number of strains of the flu that you're going to be protected against, but there's 4 times as much antigen to help produce a stronger immune response. So yeah, the messages that I really want to take home is it's very good practice to get a flu shot every year. October is my favorite month, but now is the day to act to get that flu shot if you haven't done it yet.
And I did read that this year's flu shot was, looking promising based on the Southern Hemisphere.
Yes, it has looked promising this year. And that's another good point, Chana, is that the flu shot's not perfect. It's not going to prevent every case of flu, but it does reduce the risk of getting the flu in a good year about 50%. And so those are pretty good odds to reduce the risk of getting infected.
Yeah, in fact, I read that this year is about that 50%. They saw 50% fewer hospitalizations in the Southern Hemisphere, as a result of flu shots. Yeah.
So if I can decrease my risk by 50%, I'm going to take that.
Absolutely. Yeah. I did. Now I just was looking quickly to see if I could find a link to it, but maybe it's not on our website yet. I did. We have at least one post on our website busting flu myths. So there's lots of other myths. If we had more time, we could go into busting about flu. But it's funny how there are myths actually on both sides of it. There's myths saying it's useless, and there's the myth that, well, I got to, it should offer perfect protection. What's going on here? Like I still got the flu after I had it. So what's that all about? So it's, I think we really need to wrap our heads around this idea of risk reduction, right? And
yes. And the other sort of like zombie fact that I can't get to die is that I got the flu from the flu shot.
Oh yeah.
That's impossible. So you're not going to get the flu from the flu shot. It's impossible. It's not, that can't happen. You can still get a cold or the flu after you've gotten the flu shot, but you're not. It's not physiologically possible to get the flu from your flu shot. In fact, Chana, like after you've gotten a flu shot, about how long does it take for you to be protected?
1 to 2 weeks.
Yeah,
I think it ramps up over that. Yeah, I think maybe the part of that myth is because your immune system, while it's responding to the vaccine, can give you some flu-like symptoms of you might get a fever, right? And so but that's not the same thing. That's your immune system doing its thing, which it, recognizing something foreign in the body, which is different than an infection in which you have, millions, trillions of copies of a live virus inside of you. It's not the same thing.
Exactly right. So that maybe 24 hours of feeling a little bit tired, maybe having a sore arm, that is not the flu. That is your immune system working to produce antibodies so that you don't get the flu when you encounter it. It's not the same as that, 10 to 14 days of illness should you be infected with the flu virus.
Exactly. Yeah. The duration is a big differentiator between what's a short-term immune reaction versus being actually ill from a virus.
Correct.
Yeah. Not to mention intensity.
Yes.
So, okay, that we covered the flu stuff pretty quickly. So that gives us a good chunk of time to talk about COVID, which a lot of our listeners are very tuned into, which is great. So the first question is for you. So what is the updated shot? Who can benefit from it? And is it a booster or not? There's a lot of language confusion around this one.
Yes, there's been so much chatter. And I think the bottom line is that everybody 6 months and older should get an updated COVID-19 vaccine this fall and winter. This formulation targets the XBB 1.5 variant, which is what's currently circulating in pretty high volume. And it really is about language here. There's been so many names for this new vaccine: the booster, an updated vaccine, the XBB 1.5 vaccine. I would say that the preferred language at this point is the updated COVID-19 vaccine, but all of those names are referring to the same thing. There's a dose available today that targets currently circulating strains. And so if you think of this in with the flu, you would never go to a pharmacy and say, "Can I have last year's flu vaccine?" That generally isn't the case that we do with it.
Yeah.
Same sort of theory with the updated COVID-19 vaccine. You want the updated one.
One more term just to throw in that people use around here is monovalent, right? Because they were familiar
Yes,
with the bivalent. So this
exactly.
year's monovalent vaccine, updated vaccine, and 2023 booster are essentially the same thing, but we're actually trying to shift away from the booster terminology.
Exactly. Your updated COVID-19 vaccine is what you want to get. And while the names have all varied, the what you're actually talking about is the same.
Mm-hmm.
And I think the other takeaway is that the benefits of vaccination outweigh the risks in many ways. The vaccines are very safe. So the personal benefits included a decreased risk of infection and all the kind of crummy stuff that goes along with infection, like missing activities, not being able to go to work or school, and feeling crummy. And for most, it's been a little bit since you had your last COVID-19 vaccine. So this is going to update your protection, sort of like updating your computer software. And from a population perspective, the more people that get vaccination, the more protected we are as a society to decrease the number of people being infected, the number of people experiencing hospitalizations, and also protecting vulnerable people in society who maybe not may be eligible to get a vaccination or could become really, really sick if they're encountering people who are infected in other settings.
Mm-hmm. And I think we should start to encourage people to think about the COVID vaccine similarly to the flu vaccine, that it's not going to make you immune from getting infected in the first place. There is a short-term period where your risk of being infected is significantly lower, but it's definitely not going to be zero, even at peak protection. So when we talk about vaccines and when we evaluate how well does a vaccine work, that's a question that comes up a lot. It's hard to put a real number on that because vaccine effectiveness is always dependent on the context. If someone is super well protected, but they're exposed, in an enclosed space for 30 minutes with someone who's highly contagious, they're going to get it no matter what, essentially. But you have to compare how many people got infected and how many people got to a certain degree of illness in a similar population versus people who got placebo. And that's really how vaccine effectiveness is assessed. So you can't even put a number on what's my chances of getting COVID if I have it versus if I don't, or what's my chance of, it's very hard to put numbers on those. So you can really have to think about in terms of relative risk versus if you didn't get the vaccine, how much are you reducing your risk?
Correct. It's a reduction of risk. It's not an elimination of risk. And I think it's sometimes hard to not see it as a black and white, where if I do this, I eliminate all risk. If I don't do this, I have all the risk. Almost nothing in life works that way, and vaccines are no exception to that. So,
my answer to the question of how well do they work is usually it will dramatically reduce your risk of serious illness. It will moderately reduce your risk of symptomatic kind of unpleasant illness, and it will help a little with your risk of infection. And
I think that's a great way to frame it. I'm going to steal that for when I talk to my patients.
and the weaker part of that spectrum is the shortest lived. So the protection from severe disease lasts the longest. The protection from getting infected lasts the least amount of time.
That's absolutely true, and a really great way to frame it. When do you think is the best time to get your updated COVID-19 vaccine?
Yeah, well, funny you should ask, because I did a fair amount of research on this question because I'm in Canada where guidelines are a little bit different than the US. So I was comparing the recommendations across different bodies because they're not identical, because this is not a black and white issue. Essentially, there's a bit of a trade-off here because waiting a longer amount of time in between infection and a vaccine actually has the advantage of giving you a slightly better immune response. But if you push it too long, you could get infected while you're waiting. So you're essentially making a trade-off between those two things. Canada's recommendation, where I live, is to wait 6 months after an infection before you get a new vaccine. In the US, they kind of say, you might want to wait 3 months to 6 months. It's safe to get it sooner than that, as soon as you've recovered, but the language is a little bit softer, whereas in Canada, it's pretty much wait 6 months period, unless you're meet certain very high risk criteria. And that's kind of where there's a lot of personalization to it. I would say that if you're a higher risk individual where the cost of getting COVID is very high, you don't probably want to put yourself in the situation where your immunity is so low that could happen before you get your shot. Whereas if you're someone in the more general population, you can kind of afford to wait longer and get that stronger protection, because if you do get it, it not the same consequences as someone who's higher risk.
That sounds about right. And it sounds like sort of the takeaway here is if you've recently had COVID-19, you can wait 3 months and get your updated vaccine somewhere between 3 and 6 months after you've recovered.
Mm-hmm. Yeah, I don't actually know in Canada if they would, give you a hard time if you wanted it before 6 months, but they are not keeping track of when you've had it. So in some ways, it's kind of up to you what you're comfortable with. And yeah, you might want to also consider, the current COVID risk level. How if you're in the middle of a surge, maybe you don't want to wait that, closer to 6 months. Or if you're about to go overseas and maybe you won't have access to medical care, maybe you don't want to wait the 6 months. So there's a lot of factors, which is why it's hard to put a hard number on this.
I think you're right. Well, so we know that getting the updated COVID-19 vaccine is recommended, and we've talked about the timing, but we haven't talked about which vaccine somebody should get. So we've gotten quite a few questions about is the Novavax formulation better than the mRNA formulation? So do you have any updates or wisdom on that?
I do. Yeah, this is something I've been looking into recently. I will say that the big picture message is that the vaccines have very similar safety and effectiveness profiles. So Novavax versus the 2 mRNA vaccines from Pfizer, Moderna, overall effectiveness is very similar and safety is very similar. So there's not really, there's not really good reason to delay your vaccination just to get one or the other. And I'm not going to say there's no differences. There certainly are some subtle differences. I will say that one of the subtle differences is that the Novavax vaccine does seem to have fewer short-term side effects after vaccination. You'll probably still have some side effects, but they might be a little bit milder. They might not be as many of them. It's not a black and white thing, but that's a potential consideration. And myocarditis, some people had thought the Novavax vaccine did not come with that warning. But as we learned more and we had more, just more data on that, it seems like the risk of myocarditis is actually very similar across the vaccines, small, dependent on age, sex. So what else? In terms of actual effectiveness, like we talked about earlier, it's very hard to put very specific numbers on these. And you would have to have really a head-to-head trial of these three in this exact same population to know. But just from the individual trials, the trials are not dramatically different enough to think that, that would be a reason to choose one or another. And again, the same vaccine is going to give you different results in a different population. So it's just, you have to be really careful about making apples to oranges comparisons here.
Agreed.
Yeah.
Agreed. And I think the other point that I would like to make is that it's been a little harder to find doses of the updated COVID-19 vaccine. And so if you're sort of thinking about it broadly, like, can I get a dose? Getting a dose is better than picking and choosing which dose you get.
Yes.
And so I do think that's important, is if you're choosing between no vaccine and any of the ones available, you should just get the dose available.
Yeah. And one thing I will say is that if you had a severe allergic reaction to one vaccine modality, it would be prudent to switch. That is
correct.
The official CDC guidance. And
correct.
Like a moderate allergic reaction, that recommendation is not there. But if it is severe, that's a good reason to switch platforms.
Correct. That's a great reason to switch.
And just in case anyone doesn't know the difference between the two, just a refresher, the mRNA vaccines, those vaccines work because they contain basically a recipe that your body uses to make a little bit of spike protein, which your body can then react to. This is a temporary thing. It's not entering your DNA. You're not going to make it forever. This is a short-term thing where your body makes enough spike protein for your body to respond to it. Whereas the Novavax, you're actually getting the spike protein, in the shot. So, one is the recipe for the spike protein, the other is the actual spike protein for the Novavax, which is made using recombinant technology. Anything else about the vaccine comparisons? I think I'll drop a couple of links here. Did you want to read out some of the reader questions maybe about these while I drop in some links?
Absolutely.
Okay.
So we had a reader from California ask us to discuss the differences and advantages of the Novavax non-mRNA versus COVID mRNA vaccines. My daughter, who is a physician, is suggesting I wait and get the Novavax because of the significant side effects she has seen from the mRNA vaccines. And I think, Chana, you did a great job talking about some of the reasons you might have fewer side effects from the Novavax. And I would say, again, similar to the flu, the mRNA vaccination side effects are not illness. It's your immune system working to build immunity. And so while they can be uncomfortable, they're typically short-lived.
Mm-hmm.
Another question that we had from Nadine in Wisconsin was, which of the updated COVID vaccines is best? Does it depend on past vaccines? Should I mix and match? And I would actually love your opinion on this, Chana, speaking specifically to the mixing and matching of vaccines.
I'm just wondering if I don't know if I put a question for on the screen here, but I don't think I did. So, okay, should I mix and match? I would say the jury is still out on this one. Based on what I've seen in the data, it's either neutral or slightly positive to mix and match. The earlier data we had from a couple of years ago suggested a reasonable benefit of mixing and matching. But there was a recent study this year that didn't show a benefit of mixing and matching. But that study, it didn't cover every possible combination. It was a limited study, but I think there was sort of an expectation that there would be a benefit, but there wasn't one found in that study. So I would say it's neutral to slightly positive to mix and match. For me, I've had the AstraZeneca vaccine here in Canada was available first, and then I've had both mRNAs. I was kind of hoping to get Novavax just to round it out, but Novavax is not available yet in Canada. The updated version is not yet here. But so if I were given the choice, I would have done it just to kind of, why not? It can only be a positive from my perspective, but I wasn't going to hold out and wait for Novavax to be approved and to get a slightly better, possibly, reaction.
Yes, it's so helpful to hear sort of the mental gymnastics that go on in your own head about, how we make these decisions. So I've had a Moderna and a Pfizer here in the United States, and I would take, I would take anything available, but our family has had multiple illnesses and viruses. And so I actually haven't gotten my COVID-19 updated vaccine yet. It's I'm scheduled to get it next week. And I'm going to take the vaccine that they have available at the pharmacy because I'd rather have it on board than to not have it at all.
Yeah. Eric Topol sort of had a similar situation to me. He was blogging, one of these scientist, physician bloggers. And he was saying he was kind of hoping for Novavax that, maybe it would be better, but he's like, yes, I'm just not worth the wait. So he ended up just going for what he could get. So I think that's the general thinking among experts in the field. There was one question that came into the chat. I know we said we normally just take questions in the question box, but I saw one. What about timing between vaccines? So I will say that in Canada, they recommend waiting 6 months between vaccines. So they're saying that if you had a COVID shot, wait 6 months before you get next one. But I believe the CDC is maybe not saying that. If someone had an update, a COVID shot in the summer or in the spring, would they want to wait at all before they got their updated one? Do you know?
I don't have the answer to that specifically. Okay. And I'm happy to take a look. And why don't we do a post on that on Those Dirty Girls coming up? So thank you very much for the question. Was the question specific to, and it's hard to say, but if you're speaking only of COVID-19 vaccines, there is this suggestion to wait, 3 to 6 months after you've been infected. There has not been releases of vaccines in the United States that we're getting vaccines more closely than 6 months to date, at least. If you're speaking about getting a variety of vaccines, you can get COVID-19 and flu vaccines at the same time. Some people choose to get them together. Some people choose to separate them. I take them separately because I don't feel great after I get vaccines. And so if I get them both together, I feel a little bit worse. But I have that luxury to not need them at the same time. My mom is in her, in her mid 60s. she doesn't get vaccines because she's on immunotherapy right now. And so she doesn't have these on board. And then my husband would take all of the vaccines at one time, just to not have to go back to the pharmacy. So there's different answers for different people.
Yeah.
But if you're talking about taking various vaccines, we give them together for children all the time. We give them together for adults all the time. The only one we're separating out this year definitively is RSV.
All right. Well, thanks for all the additional bonus information. We are out of time for today. So thank you all for joining us. And to stay on top of all our content, I recommend checking out our Substack page where you can sign up and it'll show up in your inbox at thosenerdygirls.substack.com. And you can check out our website at thosenerdygirls.org to submit your questions and to browse past posts. That's it for today. Thanks again for being here.
Thank you. It was great to talk with everybody.
All right. Bye-bye.